You've been told lemon is a health miracle, cleansing, immune-boosting, age-defying. But what if I told you one everyday food mixed with lemon could quietly inflame your gut, sabotage calcium absorption, and spike your kidney stone risk, all while making you feel tired, bloated, achy, or foggy? Most seniors are doing this every week without realizing the damage. Even experts miss it. Stay tuned. We're counting down the 3 most dangerous lemon pairings from least to worst. Have you ever had unexplained stomach upset after your lemon routine? Do you take meds with citrusy meals? Drop your answers below. We're reading and replying with personalized tips. Let's start with Part 1. The 3 toxic lemon combos. Number 3. Lemon with yogurt. On paper, it sounds smart. Probiotics from yogurt plus digestion-promoting lemon. But under the hood, this duo can turn into a slow digestive sabotage. Lemon's citric acid layered on top of yogurt's lactic acid can create an overly acidic stomach environment, irritating a thinning gut lining in seniors and slowing digestion instead of helping it. The result: bloating, sour burps, fullness, and impaired breakdown of nutrients, even if you're eating well. We saw a real case. Miriam, 67, was adding lemon to her morning yogurt thinking she was optimizing gut health. 2 weeks later, she was bloated, fatigued, and labs showed low B12 and mild anemia. Remove the lemon, and within days, her symptoms eased. Her energy and absorption rebounded fully. What felt virtuous was quietly undermining resilience. Quick tip: if you want flavor, add zest very sparingly later in the day instead of mixing fresh juice into yogurt on an empty or sensitive stomach. Number 2. Lemon with spinach. Lemon with spinach sounds like a health influencer's dream. Vitamin C to boost iron absorption. But spinach is loaded with oxalates, and the acid in lemon makes the release and uptake of those oxalates worse. That means not only do you get less usable calcium and iron, you flood your system with compounds that stress kidneys and can crystallize into painful stones. As kidney filtering declines with age, that burden compounds. One 72-year-old retired teacher, eating lemon-dressed spinach daily, developed flank pain and oxalate kidney stones despite a clean diet. Beyond stones, oxalates tie up calcium, accelerating bone loss in seniors already at osteoporosis risk, turning a bone-friendly meal into a long-term liability. Safer alternative: skip the lemon on raw spinach, steam to reduce oxalates, and pair with healthy fats like olive oil to aid iron uptake without unleashing the oxalate flood. Number 1. Lemon with seafood. This is the most dangerous pairing because it hides in familiar, beloved meals. Lemon on slightly past prime shellfish or fish can amplify the formation of histamine and potentially harmful compounds, triggering reactions that mimic allergies, heart issues, or neurological symptoms, especially in seniors with slower metabolism. When seafood starts to degrade, bacteria convert histidine to histamine. Acid from lemon accelerates that process. The result: symptoms like flushing, dizziness, palpitations, low blood pressure, often misread as serious unrelated conditions. One 74-year-old shrimp lover developed recurring migraines and unstable vitals. Removing the lemon cured her in under 10 days. It gets worse. Lemon can also impair how your body uses selenium and iodine from fish, nutrients critical for thyroid, cognition, and energy. Seniors consuming lemon with fish regularly showed measurable drops in selenium over months, manifesting as brain fog and weakness that were blamed on aging. Rule: don't pair lemon with seafood unless you are absolutely sure it's ultra fresh. If there's any doubt, skip the citrus or use it afterward in a separate course. Part 2. What lemon should be combined with. Number 3. Lemon with chickpeas. Chickpeas are a fiber and protein powerhouse, and lemon boosts their value. Vitamin C helps unlock non-heme iron, while the acidity reduces phytic acid, an absorption blocker, and softens the skin for easier digestion. Great for seniors with slower gut motility. Studies show older adults who add lemon to legume meals absorb more iron and report significantly less bloating. Bonus: it smooths blood sugar swings, ideal for those managing diabetes. A 2024 nutrition analysis found that pairing lemon or citrus with chickpea-based meals increased iron absorption and decreased bloating complaints in older adults. Processing techniques like pressure cooking further break down inhibitors and synergize with the citrus effect. This combo also helps blunt post-meal glucose spikes, making it well-suited for seniors managing blood sugar. If someone has a very sensitive gut, start with smaller lemon amounts and build tolerance. The acidity is helpful but can be adjusted via dilution. Number 2, lemon with broccoli. This isn't just about taste. Acidic lemon enhances conversion of glucoraphanin into sulforaphane, one of the body's most potent cellular protectors. Seniors pairing broccoli with lemon get better detox support, reduced oxidative stress, stronger liver markers, and even improved collagen signaling for joints and skin. One patient with fatty liver saw liver enzymes drop and energy return just months after making this switch. Research shows that consuming broccoli in its more bioactive forms, fresh, prepared to maximize sulforaphane, and combining it with acidity increases effective uptake and cellular benefit, including markers tied to cancer risk reduction and liver enzyme improvements. Seniors with early fatty liver or elevated oxidative stress who incorporated lemon-dressed broccoli saw improvements in liver markers and reported better energy, consistent with clinical insights on sulforaphane's systemic benefits. This pairing also supports collagen formation and joint health indirectly via reduced inflammation and oxidative load. If someone has IBS or is sensitive to crucifers, start with small portions and chew thoroughly. Pairing with healthy fats, like a bit of olive oil, can ease tolerance. Number 1, lemon with turmeric. Turmeric's curcumin struggles to get absorbed, unless you prime it. Lemon's acidity helps stabilize it for intestinal uptake, while vitamin C works in tandem to tamp down inflammation. In controlled studies, seniors combining lemon with turmeric saw substantially greater relief in joint pain and mobility than turmeric alone. One woman in her mid-60s went from relying on a cane to walking pain-free after adopting this daily ritual. Meta-analyses and randomized trials demonstrate that turmeric reduces arthritis pain similarly to NSAIDs for many individuals, and that combining it with bioavailability enhancers, acidic carriers, piperine, etc., substantially improves outcomes in mobility and pain reduction among older adults. Seniors experiencing osteoarthritis or chronic joint stiffness reported marked improvement in walking, reduced reliance on aids, and enhanced lower body strength after consistent morning lemon plus turmeric routines over 6 to 8 weeks. Beyond joints, this duo supports cognitive clarity, systemic inflammation reduction, and even skin health via oxidative stress modulation. Turmeric can interact with blood thinners or gallbladder issues. People on medication should check with their provider, and those with sensitive stomachs might start with a smaller dose. Part 3. Top 3 Lemon Habit Mistakes. Number 3. Drinking undiluted lemon water first thing on an empty stomach. Many older adults do this believing it detoxes, but a thinning stomach lining plus concentrated citric acid can erode protective mucus, leading to gastritis, heartburn, and discomfort. One 70-year-old with chronic upper abdomen soreness reversed her symptoms simply by diluting lemon water and moving it to after a light meal. Studies on gastric physiology show that acidic intake on an unbuffered stomach can worsen reflux and mucosal stress, especially when gastric emptying is delayed. Seniors in observational reports have reported increased heartburn and upper abdominal discomfort with this routine when done without adjustment. Number 2, blending lemon with high oxalate greens or heavy medication routines. Lemon in smoothies with kale, beet greens, or chard can increase oxalate absorption on top of citrus compounds that mess with liver enzymes responsible for breaking down drugs. The result, medications like thyroid hormones or blood thinners clear slower, causing fatigue, cognitive fog, or lab swings. Seniors have seen reversals just by separating those ingredients. Green smoothie overconsumption has been linked to hyperoxaluria and kidney injury. Blending increases oxalate bioavailability and quantity consumed. Fruit juices can cause clinically significant drug interactions via CYP450 inhibition and transporter effects, altering medication exposure in seniors. Number 1. Brushing teeth right after lemon water. The acid temporarily softens enamel. Brushing during that window causes tiny, permanent abrasion, accelerating thinning, sensitivity, and decay. Data shows seniors who brush too soon suffer erosion at dramatically higher rates. Wait 30 to 45 minutes or rinse with plain water first if you need a quick clean. Older adults often already have mild enamel wear or exposed dentin. Additional microabrasions accelerate decline. Salivary flow can decrease with age, slowing natural remineralization after acid exposure. Dental experts recommend waiting at least 30 minutes, some guidelines say up to an hour, after acidic exposure before brushing to allow saliva to rebuild a protective pellicle and reharden enamel. Lemons can be a healing, energizing ally, or a hidden risk depending on what you pair it with and how you use it. Avoid the dangerous trios: yogurt, spinach, and questionable seafood. Embrace smart combinations like chickpeas, broccoli, and turmeric, and stop the subtle mistakes. Timing matters. Now I want to hear from you. Have you ever had weird symptoms after mixing lemon with your meals? Which pairing surprised you most today? Drop your age, location, and story below. We read and reply to help you refine your routine. If this gave you clarity, hit subscribe and turn on notifications for the next breakthrough. Thanks for watching.